All right, what's up, everyone? Happy Wednesday. I'm back. So, big shout out to our nurses for holding it down while I was out of town and out of office. So, it is Cervical Cancer Awareness Month. So, with that, we decided to do some women's health. A lot of high yield, next gen questions that come out of women's health. And not just, I'm not just talking about cervical cancer, I'm talking about things like PID, which we'll talk about, endometriosis, ectopic pregnancies. And as you can start to formulate the signs and symptoms, you can kind of already see that there's a great case study or bow ties that can come out of these. So we'll get into those fairly heavy. But before we do that, we do have some people that made it to the other side. Sorry, I'm still battling this cough. So Nurse Janki, where are you at? Let me stop my share.
Yes, sir.
Hey, Nurse Janki, how are you?
Good, sir. How are you?
I'm doing well. I'm doing well. So Nurse Janki, I recognize this name because you've been around and I see you always participating in everything. So why don't we start with first and foremost, what of NCLEX High Yield did you use?
I used the live course in November.
Yep.
Yeah.
And you participated a lot. Like you were active in the chat, you would ask questions, and excuse me. And so now, what attempt was this for you?
It was my fifth attempt.
Fifth attempt. And how many questions were you?
85 and out.
85 and out. Look, I couldn't make this up if I tried. We are not just preparing you, we're over preparing you for these boards. How confident did you feel about taking the exam and walking out of it?
Um, uh, with my previous attempt, I was like so scared. But this time, when I sit for exam, like I always keep in mind, I'm not going for exam. I'm going for assessment. Like
Yeah.
and it was make me reduce my anxiety.
Absolutely. So using the
Yeah.
live course in November, because the live course ended end of November. So
Yes.
really you only about a month, maybe a little over a month after the live course. So you took
Yes.
maybe two total months, give or take, to be ready to take this on your fifth
Yeah.
attempt and pass.
Yeah.
That's amazing. That's amazing.
Yeah.
So Nurse Junkie, what is your advice for people on the other side?
I always advise that just stick with the method and use you world's questions and like when I used to do the questions, I always remember like these things doctors did teach us, like otherwise I didn't know that before this one. And
Go good.
I used that last time as well, and I used your free content, but
Okay.
it wasn't work for me on my fourth attempt. But this time I used, like as you said, like do 440s every day. So I used to attend your class and I stick with the 440s every day, and I use whole q bank this
Good.
time.
You followed
Yeah.
our instructions and you passed
Yeah.
85 and out. That's
Yeah.
basically, it's that simple, right?
Yeah.
So that's amazing, Nurse Junkie. We are so proud of you. Welcome to the other side, 85 and out, fifth attempt. And here we are. You're now a licensed, is it RN or PN?
Yeah, RN.
RN. You're now a licensed RN. Congratulations. Congratulations so much.
Thank you so much, sir.
You're
Thank you
very
so much,
welcome. So,
whole NCLEX higher team. Thank
oh
you.
yeah, yeah. There and a lot of them are in here. So absolutely.
Yeah.
It's a team effort. It's a team effort.
Yes.
Thank you, Nurse Junkie.
Thanks,
All
sir.
right, no problem. All right, next up we've got Nurse Akila. Where are you at? And I hope I pronounced it right. So please do correct me if I'm wrong. Whoops, where are you at? Here we go.
Hi, I'm here.
Did I say it right or did I totally butcher it?
It's okay. It's Aquila, but it's okay.
Aquila. Okay. All right. Look, people butcher my name. That's why I always ask. If I say it incorrectly, please do correct me.
It's fine.
So Nurse Aquila, what of NCLEX High Yield did you use?
I used the self-paced course.
Self-paced. So we have two different types of courses. One is where you're on your own you get all the 70 hours, or you're in the live course where it's a little bit more hand holding. So you were more of an independent studier.
Yes.
Okay. So I get both types. I deal with so many students. So I understand when people are like, you know what, I'm just gonna do this on my own pace. That's why we have the self-paced one. So what attempt was this for you?
This was my first attempt.
One and done.
Yes.
So and then how many questions were you?
85 and out.
85, 85 and out. Come on, everyone, look at this. We are doing 85 and out for a reason. So just out of curiosity, what made you choose NCLEX High Yield? How did you hear about us that you were like, I haven't taken this exam before, but I'm just going to go with this on demand? Because a lot of people are skeptical. They're like, yo, like, who are these people? You know, regardless of our accreditation, like, people are still skeptical because there's a lot of scammers out there.
Right. I think I found you guys on YouTube. So I found the channel on YouTube. I started watching a couple of the videos and I was like, okay, I like this. I like the content. I like Dr. Z. I like his voice. And I was like, okay, I need more of this. Where can I get more of this? And then I went to the website and I saw the different plans that you guys have. So what really caught my eye was the on-demand course because like I'm an independent person. I like to study by myself.
Right.
Did that and I bought it. I planned out when I was going to buy it because since it's only 40-day or 45 days of access,
Right.
I planned it so that I would buy it and finish it like maybe at least a week before I took my NCLEX.
Right. So you actually took about that. I always tell people the sweet spot, if you're truly studying, whether it be the live course or you're doing the self-paced on demand, is at 6 to 8 weeks. So yours was essentially about 6 weeks. You
Right.
took the 45 days and that was your comfort zone, and you felt confident enough to go in and knock it out with 85 and out. So,
Yeah.
RN or PN?
RN.
RN. So another license to RN under the belt. And what would be your advice for people on the other side?
I actually have two pieces of advice.
Please.
The first one is do practice questions because you can watch a whole bunch of lectures, you can watch a whole bunch of videos and think, okay, this is not that bad, this is easy. But then come test day, you're like, wait a minute, it's not just content, it's about application. So if you don't train yourself now to apply what you learn, then you're not gonna do very well because that's what NCLEX is about,
100%.
application. There are some freebie questions, like you said.
Yeah, yeah.
But it's the NCLEX is not all about freebie. It's about application.
100%. I actually just had this conversation with a student. So obviously I make calls. Those of you that have spoken to me will know that I do actually pick up the phone and call people. And I actually said, I go, you need to know your content. But the second part of that is applying it. So you do need a Q bank and you have to do those practice questions. And the third part is those test taking strategies. As you said, the 5 types of questions, you identified the freebie ones. But yeah, it is a combination. It's a board exam. So absolutely, absolutely. So anything else that you have as far as advice for people on the other side?
Yes, the second advice is for anyone thinking about buying the course, when you buy it, not if you buy it, when you buy it, if you take away nothing from this man, the one thing you need to know is ask Graph. Ask Graph will save your behind. I'm telling you right now, ask that Graph because NCLEX knows that you know how to prioritize. If you know who's gonna die first or who do you have less time with, they are okay. This person has that 95%
Yeah,
score. So they're really gonna know that you know your stuff. So ask Graph, pay attention to ask Graph.
absolutely. I think there's so many things that I've had the fortune of creating with my crazy self. And AskGraph was definitely my claim to fame. So absolutely, I think it's a great thing. Not only are you going to use it in your boards, I can almost guarantee you when you interview that they're going to give you some sort of a prioritization question as well too. Like they're going to see if you know who, like you said, you have less time with. So that is amazing. So thank you so much for joining us, sharing your journey, and congrats for being on the other side.
And I want to thank you and the rest of the NCLEX High Yield team. Keep it up. Keep doing what you're doing.
Thank you so much. We appreciate it. All right. So with that said, Nurse Zena, while I get set up here, what's going on with you?
Hi, everyone.
So
For the first
Nursina is
time after
one of our
5,
top educators as well too. So
thank you. For the first time after 5, my daughter is napping. So if she's napping, I'm on here with you guys. Of
I love it. Take advantage of those naps. I love that you're spending it with us as well too.
course, there's no better place to be on a Wednesday. You guys know this.
Yes, definitely. All right, cool. So quick, I'm going to go through announcements really, really quick because I do want to get into our lecture and some next gen questions. We got a bow tie. We got bow ties, or we got a bow tie. We got a case study, and we got some prioritization questions as we just talked about. So first and foremost, again, financial assistance letter. Try and find places that will give you financial assistance. The letter is written out for you. Fill in the blanks. Tutoring. You've met Nursina, Nurse Crystal, Nurse Brittany. All our tutors have been in your shoes. Work with them because, as Nurse Aquila said, was learn Ask Graph. But if you find a random tutor, they're not going to know what Ask Graph is. So our tutors are trained and been in your shoes. Use our free resources. Self-paced, as Nurse Aquila had. And then our live course, you can late enroll. It's easy to catch up, as Nurse Junkie was in our live course as well, too. So again, if you want to join, you can always join. Reach out to us. You can email us, Instagram. You can contact us in any which way. Self-paced, as we just talked about, if you want it as well, too. Great investment. Our WhatsApp community is growing and it's growing fast. So join before it fills up. We do some special questions on there. It's kind of like different platforms have different types of posts and different content that we offer. So every different resource that we have, whether it be the podcast, YouTube, WhatsApp now, our Instagram, TikTok, so on and so forth, all have different things on there. Again, our tutors are phenomenal. And if you want a taste of what we do, Rapid Review is only $99. And then if you want me or Nurse Brittany to interpret your CPR report, we will go over it with you on the phone. So we will 100% call you and go over them with you, submit them via that code. And then, okay, so people that are repeat test takers, only repeat test takers. These are the important announcements that are new. Those that are repeat test takers, I'm giving you an opportunity to have a 2-hour pharmacology review. The reason why I'm doing this is that I'm building I have a questionnaire. Those of you that know my public health and society, my fundamentals in clinical trials, my statistics in medicine, and my MD come from places like Harvard and Stanford School of Medicine. I am working on a publication focused on repeat test takers. That means that I want to know why you are a repeat test taker and I want to publish it. Do I take your name and your personal information? No. It's general questions that I want you to answer. Were you anxious? Do you feel like your school prepared you? Just things that I want to be able to publish without obviously putting out any personal information. You don't have to enter any of your personal information, but I would appreciate it. We've got over 700 people that have put in their information that have helped me build more data. And again, with my background from Stanford and Harvard School of Medicine in doing statistics and publications like this, it's going to help me and people around us in other schools help you as not becoming a repeat test taker or helping as a repeat test taker. This is really cool. This is something you want to watch. We're doing a guaranteed pass. It's a competition. Okay, guaranteed pass. I'm guaranteeing your pass and $1,000 in cash. That's $250 a week for a month to help you with your rent, with your food, with whatever. All you got to do is submit a video, 30-second video, why you should get the guaranteed pass and why you should receive that $1,000 in cash. So it doesn't cost you anything. Only 20 people are going to get chosen. That's it. So if you want a guaranteed pass and $1,000 in cash, it's a competition. It's going to be fun. Nothing crazy. Come and enjoy. Get your chance at a guaranteed pass, guaranteed by me, right? Submit your video to us and $1,000 cash. We will wire it to you in increments of $250 a week. So it's an allowance. So why not? What do you have to lose? It's free. So take advantage of that. Watch the video. You kind of get an idea of it. We're going to be promoting this throughout the course of the month. So we are also doing guaranteed pass. If you're interested, you can contact us about that and we will call you. All right. I apologize in advance. I do have a respiratory infection, so I've been coughing for the last couple of days. But now, let's get into cervical cancer. So when we talk about cervical cancer, let's put women's health aside, right? Let's put women's health aside and let's just talk about cancer in general. Cancer in general. What are two things that I'm looking for with cancer for the sake of the boards? They're always going to show up. Unintentional weight loss and family history. Good. These are two things that you're always going to look for. The minute you see unintentional weight loss, you're thinking cancer. I would take tuberculosis as well because you do have that unintentional weight loss, but it's screaming at you cancer. Okay. And the next one is family history. So these are risk factors and or signs and symptoms that are definitively going to show up when you're dealing with cancer. Risk factor, family history, you're going to check it off. And signs and symptoms, unintentional weight loss in any type of cancer. So those of you that have the on-demand, those of you that have been in the live course, my sister teaches oncology, and she goes over that in depth as we teach you different types of cancers. But now we're going to focus on cervical cancer. And the thing about cervical cancer is we're looking at the cervix. And it is a malignant tumor of the cervix. And the problem with this is that it is directly linked to human papilloma virus, HPV. What about HPV makes this so scary? Why are we so concerned about cervical cancer? HPV is the number one STI worldwide. So if you're dealing with the number one STI worldwide, leading to something that's going to be malignant, a cancer of the cervix, do you think the boards are going to potentially put this on a case study? 100%. 100%. If you're going to get a women's health, this is a great subject. What other risk factors we have? Well, smoking. How much is smoking tied to? Not only smoking, I'm going to add one more in here. ETOH, alcohol. Those of you that are reading the news or looking at articles on whatever website, how many articles have popped up in the new year about alcohol? Avoiding alcohol, Surgeon General talking about alcohol, preventable cancers because of alcohol, right? So again, what do we teach them about with their needs? Just gave it away. What do we teach them about risk factors? Always teach your patients about their needs. Proper nutrition, yeah. Exercise, yeah. No alcohol, ETOH. Don't smoke, and get proper sleep. So again, maybe not all of them apply to cancers, but needs is something that you should know. It's one of those mnemonics that we just talked about, like ask graph, NIPA, needs. You need, no pun intended, to know. The other one is multiple sexual partners, because again, it is an STI. So we get this dysplasia. Dysplasia is changes of the cell, and it progresses into this cancer. So signs and symptoms for cervical cancer are going to be stages, early and advanced. So early stage of cervical cancer is going to be asymptomatic, but that's not what we're going to look at for the boards. What we're going to look at for the boards is the advanced signs and symptoms, because now we're talking about a select all that apply or a matrix or a grid type question. So now we're looking at abnormal bleeding, that pelvic pain, discharge, that adnexal pain as well too, right? In the pelvic area. So another word for that pelvic pain, look at adnexal. So very important to understand the signs and symptoms and educate them. That we are going to do a pap smear starting at the age of 21. And we're going to do it as frequently as needed. That's a depends question. It's a kind of a variable question. Family history, how active they are sexually, how educated they are, so on and so forth. So we don't ask about that, but the age is 21. So when it comes to screening guidelines, it is education, 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 which means I can ask this as what type of a question? Further teaching, further intervention, 100%. Oh, I don't have a family history of cervical cancer. I really don't think I need to be screened. Further teaching, further clarification, further intervention, right? So yes, we are going to check them starting at age 25. How do we diagnose it? Well, with most cancers, we are going to do a biopsy. So look for most cancers, we're going to look at a biopsy. Another way is a colposcopy, which we can actually visualize it. And then now we must manage it. So if we do have some cancerous cells, we can do cryotherapy, or we can do a LEAP procedure. Management is going to be a type of treatment, right? Management treatment. So what type of a question is that going to be? Well, of the 5 types of questions, it's going to be a freebie question. Either you know it or you don't. I could even put multiple ones in there and make it a select all that apply as a part of education. So with management of cervical cancer, which is the following treatments or management would be most appropriate, select all that apply. Select all that apply. Cryotherapy, LEAP, your loop electrosurgical excision. So we are actually using a wire loop and cutting it out, essentially, burning it out. Surgery, cutting it out. Chemoradiation, self-explanatory. But now we take this a step further. What if I was to ask just a pharmacological question regarding chemo and radiation? I'm talking about an antiemetic that is going to be used for patients that are on chemo or radiation. What medication am I going to? Now let's deviate into pharm. We are talking about ondansetron, which is known as Zofran, but again, we're always going to deal with generics. We're always going to be dealing with generics. So ondansetron. So now we deviated from not just cervical cancer and women's health. Now we went into a little bit of NIPA, because what antiemetic is a good antiemetic for people that we start on NIPA that have nausea, vomiting? Ondansetron. Now we go into a little bit more oncology, chemoradiation, pharm, ondansetron. So you see how we are combining not just women's health, we're bringing in all of medicine, because that's how the boards are going to ask this. So again, how are we going to prevent this? Well, we have a vaccine against HPV. The thing about HPV is there's like 40 different types, 40 plus different types, if I'm not mistaken. But we have vaccinations to the ones that we're concerned about, and then we're going to educate them on safe sexual practices. Safe sexual practices. Now getting into the most common STI worldwide. Now it's after 2019, if my brain serves me correctly. After 2019 is when HPV became the most common one. So in the last 5 years, 5-6 years. So HPV, human papilloma virus. So again, sexually transmitted virus that we're worried about developing into cervical cancer. We talked about the epidemiology, transmission, sexual contact. So again, educate your patients, educate. And then the high risk are the ones that we're concerned about. We're not going to get into which types they are, because that's not what the boards are going to focus on. But we know that the high risk HPV is going to lead to that cancer. And how do we screen for it? Well, we do a DNA testing during your cervical screening. And then we talked about the management, prevention. If it is a virus, we're talking about an STI viral infection. We are worried about vaccination. A board favorite. This is arguably, when it comes to women's health, this is arguably one of the highest yield topics that I've seen on the boards, and it is pelvic inflammatory disease. With pelvic inflammatory disease, we're worried about the female reproductive tract, because what's happening is that we have an untreated STI. And your common STIs that are going to cause pelvic inflammatory disease are chlamydia and gonorrhea. Are these ones that we have to report and treat the partner? Yes, they are. So make sure that we're understanding, or we're educating, that we will have to report this, and 2, you will have to treat your partner. So what are the risk factors? Select all that apply. Multiple sexual partners, history of STIs, and IUD use. Why is IUD use? Why is IUDs correlated with PID, with pelvic inflammatory disease? Because is IUD a barrier contraceptive? It's not, right? IUD is not a barrier contraceptive. So what it's going to do is people are going to have unprotected sex because they're not worried. And if one partner is cheating on the other, or one partner gets it, they can go back and forth and give it to each other. So that's why IUD use is in there. Symptoms: that pelvic pain, adnexal pain, fever, abnormal discharge, and irregular bleeding. So again, now we looked at cervical cancer, we're looking at PID, signs and symptoms starting to correlate or overlap. And now we're concerned about what? A matrix or grid type question. But when we get an STI like chlamydia or gonorrhea and we're not treating it, it's going to scar portions of the reproductive tract. And if it scars portions of the reproductive tract, we're worried about infertility. We're worried about ectopic pregnancy, which we're going to talk about, that chronic pelvic pain. So how are we going to diagnose this? Well, we must do a clinical exam, and then we must confirm it with STI testing. Clinical exam, clinically diagnose them with signs and symptoms. STI confirmatory, as we talk about, elevated ESR and CRP. So now we're going to get into some labs real quick. And this can be something that you'll see in rheumatology. This can be something you'll see in different types of labs, in different types of pathology. What is ESR? Erythrocyte sedimentation rate. Erythrocyte sedimentation rate. And C-reactive protein. Both of these lab values can be used to determine what pathological process. It indicates inflammation. It indicates inflammation. So when you see somebody order an ESR, and I'm not going to get into why, but there are markers on the red blood cells that make it heavier. So erythrocyte sedimentation rate, C-reactive protein is reactive protein to inflammation. You don't need to know all that, but you see these two lab values, it should be a automatic clue to that there's some sort of an inflammatory process going on. So that means any type of inflammatory process in any system, look at these two lab values and think inflammation. And then we can diagnose this with ultrasound as well too. Now, the treatment is what? Ceftriaxone, doxycycline, and metronidazole. Doxycycline, and I have a mnemonic here that I found that was so cool. Bear with me, bear with me, bear with me. Where did I put it? It's in my notes. Sorry. Oh, where did it go? Okay. Oh, here we go. So this is the mnemonic to remember the treatment for PID. And it is ceftriaxone does manage PID. So ceftriaxone, obviously a given, does for doxycycline and manage for metronidazole. Is it one of the three, two of the three, or all of the three? It's all of the three. It's not plus or minus. It's ceftriaxone plus doxycycline plus metronidazole. So ceftriaxone does manage PID. So another little quick tip, or another little mnemonic, if you want to, or a little a quick tip that we're putting into our books. Which reminds me, our quick tip books are back in stock. Somebody asked that. So our quick tip books are back in stock. So ceftriaxone does manage PID. Cool little mnemonic there. And then again, prevention, safe sexes, and early STI. Thank you for helping out and typing in the chat. Amazing. All right, now let's get into some practice questions. So the first one is a bow tie. I like to start off with next gen questions, because what we're seeing now is, and I should have asked this to our two interviews today, they were both 85 and out, and I can almost guarantee you more than half of their exam was next gen questions. So the boards used to be, a year ago when they started changing over, 15% was next gen. Now it's probably, if you're 85 and out, like our students are becoming, it's probably gonna be more than half your test. So we create bow ties and case studies to show you that these are still the 5 types of questions that I talk about. So with bow ties, it is diagnostic, differential diagnosis. So it is freebie questions. So we have a nurse caring for a 28-year-old female presenting to the ER, severe lower abdominal pain, fever, abnormal vaginal discharge for 2 days, history of untreated gonorrhea, sexually active with multiple partners. So if I was to take away the abnormal vaginal discharge and gonorrhea, I open up a plethora of differential diagnoses: lower abdominal pain, fever. But do you see that I can throw in lower GI along with reproductive and make them differential diagnoses? In this situation, I made it just more specific to women's health, because now we're talking about abnormal vaginal discharge for 2 days, and I'm giving you that this person is sexually active with untreated gonorrhea. So what do we think the diagnosis is, just based off of that? PID, yeah, untreated gonorrhea, sexually active with multiple partners, lower abdominal pain, but let's see what else they've given us. So the pain is 8 out of 10, crampy abdominal pain, worsen with movement. So what is that, worsen with movement? Give me the term I'm looking for with PID. Anybody recognize that term? Cervical motion tenderness? Pelvic pain. Yeah. So denies nausea, vomiting, but states has had irregular vaginal bleeding. Patient appears uncomfortable and febrile, cervical motion tenderness noted during pelvic exam. Abnormal purulent vaginal discharge. Purulent vaginal discharge. So we go over to our lab results. Elevated white blood cell count. Now, hold on. Those that are my students, which white blood cell count is elevated here? This is real life. It is, in fact, neutrophils, because this is what type of infection? It is, in fact, a bacterial infection. So not only are you going to walk into the real world and tell me that this is elevated white blood cell counts because it's above 11,000, but now you're going to tell me with differential which white blood cell count is elevated, because now you're going to be like, wow, wait, the neutrophils are elevated, so this is actually a bacterial infection. There you go. Now you're impressing everybody around you. CRP elevated, ESR elevated. Wow, well, it looks like there's an inflammatory process. Well, I thought it was PID, and what is the operative word in PID? Pelvic inflammatory disease. Look at how much more confirmation I'm building on what I already thought was a differential diagnosis. You see, this is real life too. So I want you to see that I'm not just teaching you for the sake of the boards. I'm teaching you how to be a real, amazing nurse in real life. Because what do we say? We will be the best nurse. And now we've got positive for gonorrhea, urine analysis, no significant findings, and HCG is negative. Vital signs, temperature, 101.5. So again, above that 100.4, another confirmatory vital sign. Pulse elevated, respiratory rate, no big deal. Blood pressure, no big deal. O2, no big deal. We have that bilateral adnexal tenderness, which is that pelvic pain. It's that pelvic pain. No ovarian torsion or abscess. What do I say about ovarian torsion? This is one of those outliers. Make a note of this. It is one of those outliers to ask graph. Ovarian torsion or testicular torsion are outliers. They don't fall into ask graph. They're not airway sepsis, potassium, glucose, lethargy, grunting, altered metastasis, peritonitis, or hemorrhaging. They are in fact outliers, but they are medical emergencies. They are ones that you are freaking out about. We do see fluid in the cul-de-sac, which is suggestive of that inflammation, which again, we've confirmed on multiple levels. So what are our differential diagnoses? Well, we've already kind of formulated in our head what the diagnosis is, right? And now we must determine which one of these it is. So endometriosis. Well, what is endometriosis? And we'll talk about this in the case study that comes up next. Endometriosis is the tissue inside the uterus that has now become outside the uterus, right? It's endometriosis. So we're outside of the endometrium, the inside of the uterus. Ovarian cyst, pretty self-explanatory. But again, unless this cyst ruptures, we're probably not concerned about that fever or that adnexal pain or that pelvic pain or that cervical motion tenderness, right? So again, we're looking at something, ovarian cyst, I mean, those that have, that have dealt with women's health and or have dealt with this, with ovarian cysts, some of them go undetected until they actually get inflamed, right? So this is not saying a ruptured ovarian cyst, it's saying ovarian cyst. Enlarged or inflamed ovarian cyst, maybe, okay, we'll consider that. But because of the sexual history, we're concerned about pelvic inflammatory disease, that gonorrhea, again, helps us determine that this is going to be some sort of STI leading to pelvic inflammatory disease. And then our last differential diagnosis is ectopic pregnancy, which again can develop because of PID, if we get implantation of the embryo outside of the uterus, right? So what are we going with our differential diagnosis? What type of a question is this? It's 100% a freebie question. It is a diagnosis. Either you know it or you don't. And we are going with 3. Excuse me. So now what are we going to do about it? How are we going to treat this? So again, freebie question. So we look at our action to take. I always still stick with the method and start with the bottom. If this is a PID, and it is in fact caused by gonorrhea, we just learned the mnemonic, ceftriaxone does manage PID. So does this scream to you an action that we would take? I would say yes. So I'm going to hold on to 4. Prepare for immediate surgical intervention. Well, between administer antibiotics and prepare for surgical intervention, I don't think this is any of those situations. This doesn't look like endometriosis. This doesn't look like ovarian cyst. This doesn't look like ectopic pregnancy. So yeah, I'm probably not sticking with 3. I'm going to look at administer antibiotics and compare to number 2, which is administer oxygen. But what was the oxygen? Yeah, it was good. It was 97%, right? So we're not concerned about it. Respiratory rate was fine. We're not concerned about it. So already by using the method, I have 100% narrowed it down to the two that I like the most. So how are we feeling about 1 and 4? I would agree. Again, freebie questions. What are we going to monitor moving forward? We start with the bottom using the method. White blood cell count and inflammatory markers. I think that sounds pretty good to me. Yeah. Or pain level and response to treatment. I'm kind of sticking with 4, unless I find something better, because pain level was, what, 8 out of 10? Okay. What about signs of peritoneal irritation and worsening sepsis? Febrile, tachycardic, not quite hypotensive yet, but still, can PID lead to sepsis? Can gonorrhea become available in the bloodstream? Yes, 100% it can. So over pain level and worsening sepsis, which of the two are you more concerned about? I'm probably going to go with the sepsis. Yeah, it does become a little bit more of ask graph right there, right? Ask graph right there. And beta blocker for elevated heart rate, well, I'm not really too concerned about that because that's more of a response to the infection. So in fact, we have chosen 2 and 4. If you notice, bow tie questions are not that complicated if you know how to approach them. They're very straightforward. They're predominantly freebie questions, the 5 types of questions. Remember that nothing has changed in everything that I've discovered regarding this exam. So your rationale is right there as well too. And now let's go on to a case study. So case study, we're dealing with the same type of patient. Again, 28-year-old, emergency department, lower abdominal pain, vaginal discharge, untreated gonorrhea. So same exact patient that we're dealing with, 8 out of 10, medications none, allergies none. They're giving us a little bit more because now with a case study, we're giving you an H&P. We're giving you a history and physical. And again, we're looking over, vitals are the same thing, diagnostic results, same thing. So we're looking at the same picture, we just turned it into a case study. So you see the same scenario can be presented with the bow tie, with traditional questions, or with the case study. But with the case study, I'm going to take it a step further. With the bow tie, either you know it's PID or you don't. With the case study, I'm going to make you do differential diagnosis, and I'm going to make you do a matrix or a grid. And that's where it becomes a little bit more complex. That's why when people say you must know your content, you must know your content because you don't know which way they're going to ask it. So now, the first question, 1 out of your 6 for your case study. Which finding requires immediate follow-up? Immediate follow-up. So we're looking at, starting from the bottom, excuse me, and I'm telling you how many I'm looking at. So I'm looking at exactly 4. The cool thing about case studies is if they're going to give you a highlight question or a select all that apply question, they may very well give you the number of findings that you must highlight or choose, which means you're looking for the 4 that scare you the most. So purulent vaginal discharge, is that something that we're freaking out about? Maybe. We'll hold that, we'll put that in our back pocket. So we'll put a little maybe behind that. Elevated white blood cell count. Okay, that's something I'm definitely concerned about. How about abdominal guarding? That's something I'm definitely freaking out about because that could be peritonitis. It could be a result of sepsis, peritonitis. Sorry, my handwriting's horrible. Or sepsis. Fever of 101.8. Okay. Positive gonorrhea, PCR test. Okay. They all sound kind of good. And that's what they're going to do. There's the reason I did this on purpose. The ones that I'm freaking out about, purulent vaginal discharge, is that something that I am freaking out about? Freaking out about is a very strong term when I'm talking about immediate. I'm not freaking out about the purulent vaginal discharge, but I am concerned about the elevated white blood cell count. Could I have purulent vaginal discharge and not have elevated white blood cell count? Yes. So now I'm concerned more about this elevated white blood cell count because that is indicative of that infection. And abdominal guarding, well, I just told you peritonitis and sepsis, and I'm confirming that with a fever. And now I'm finding the causative agent. But what about that cervical motion tenderness? In this patient that has PID, well, there could be other things that cause that cervical motion tenderness. There could be other things that cause that purulent vaginal discharge. But the combination of these four is scaring me. It's scaring me. So it does take a little bit of logical deduction and critical thinking here to put these two in the back burner and stick with the other four. So again, very important to understand that I'm going to throw in things that are there. But now look at this. Let's just say we didn't choose elevated white blood cell count. Let's say, you're very welcome. Let's say we chose purulent vaginal discharge. So what did I get out of here? I got 1 right, 2 right, 3 right, 4 right. I got 4 out of 6. That is 2/3. That is 66%. Not bad if I made a mistake, right? So again, we're worried about not focusing on one question. We are concerned about moving on to the next question, getting as many as we can get right. Because now I'm not focused on, wait, did I get that one right or not? No. I've got time to make this up. And as long as I'm getting a majority, I'm still getting partial credit. Now comes our matrix or grid. Now look at what we talked about. PID, endometriosis, and ectopic pregnancy. Did we not just say that those are differential diagnoses? We sure did. So now, how do I treat matrix or grid? Everyone that's been following me knows, do I go horizontally or do I go vertically? I go vertically. I go column by column, right? Because I know PID, and I'm not going to go one to the other and jump to the other. I'm going to focus and stay in my lane. Stay in my lane. Will PID have a fever? Yes. That adnexal tenderness. Yes. Is there a chance that this person has a positive gonorrhea test? Well, it was given in the case study, so yes. CRP. Well, we talked about inflammation. Yes. Will PID have a negative HCG or a positive HCG? It will have a negative HCG. There is no embryo that is being implanted or being made anywhere. So again, negative HCG. All right. I feel comfortable with that column. Okay. Because I didn't worry about endometriosis. I didn't worry about ectopic pregnancy. I focused just on my one column. With endometriosis, do we have a fever with endometriosis? Not above 100.4. Not above 100.4, right? How about that adnexal tenderness? Adnexal tenderness. Yes, because again, that tissue is outside the endometrium, and now we've got this pain developing in the pelvic area. Does endometriosis have anything to do with gonorrhea or STIs? No, it doesn't. Whoops. And will there be inflammation in this situation? If there's tissue that doesn't belong outside of the uterus, is the body going to react to that? It is. It is. So it's going to cause inflammation. It's going to be this foreign tissue that we're not used to having outside of the inner part of our uterus. So yes, CRP will be negative. And will this have a negative HCG? Is there anything about pregnancy in here? No. No fever, no fever. It's not an infectious process. Remember that. It's not an infectious process. So again, it's tissue from the endometrium that's outside the endometrium, outside the uterus. And now we're down to our last column. Ectopic pregnancy, will there be a fever? Is that an infectious process? No, it's not. Will I have that adnexal tenderness? Yes, absolutely. Where is the most common location for ectopic pregnancy? The fallopian tube. Fallopian tube. Does this have to do with a positive gonorrhea test right now? Right now? No. Could this have been from PID? Yes. Could this have been from untreated gonorrhea? Yes. But is the ectopic pregnancy directly a result of a positive gonorrhea test? No, it's not. It's not. It's because the embryo is implanted outside the uterus, right? So is that going to cause inflammation? It is. It is. Yeah. And then will this have a negative HCG or will this show a positive? Positive. So I'm not choosing negative HCG. But let's just say I saw somebody, and I love the honesty, by the way. I saw somebody put in there that I would have potentially chosen a positive gonorrhea test. Okay, cool. You chose this. Big deal. Maybe you're into your test 2 hours, 3 hours, because we're going in thinking of 150 questions, and I accidentally thought negative HCG. I mixed it up with positive HCG, and I chose that. Those are the two common ones that I would see in this situation that would be a mistake. How many questions do I have here? I've got 15 questions, and I missed 2. I got 13 of my 15 questions right. Somebody do the math for me. Like 87, 86%, 87%, something like that. Let's just say 86%. All right, so 86%, 66%, that's what? 152 divided 76%. So that first question that I got a 66% on, and the second one I got an 86% on, I'm now averaging 76%. Am I passing with that? I am. And now you continue with the method, you continue with AskGraph, you continue doing all that stuff, and you will see that, in fact, that score is going to set you apart from everybody else. So now, what are we at risk for developing? What are we at risk for developing? In this situation, we're still dealing with PID, but we're dealing with this patient that's febrile. So are we dealing with infertility here? We're not necessarily thinking about infertility at the moment. Osteoporosis, didn't even talk about that, but I'm concerned about sepsis. What type of a question is a drop down? A freebie question. Sepsis, due to what? Recurrent pelvic infections, lack of vaccination, or poor nutrition. Wait, did I do that one right? No, not sepsis. Sorry. I made a mistake here. Recurrent pelvic infection and not sepsis, because what we're worried about is infertility. Sorry. Mistake on my end. So we're worried about infertility because this patient's blood pressure was still intact. This patient's heart rate was not totally through the roof. So we're more worried about what they're developing in the long run. And that is, you had it right. Yes. I've had a long day. I apologize. Wednesdays are my Mondays. So I brain farted right there. It is, in fact, infertility, and it's because of the recurrent pelvic infections. Okay. So yeah, sorry about that. Sorry about that. I'm only human. I'm only human. I'm allowed to make mistakes. I'm only human. And this has happened to me a lot. Sometimes I'll write a question and I won't even I'll accidentally brain fart it. It happens to the best of us. So again, I would have missed this one on the test, but we still would have scored higher moving forward because I wouldn't have thought too much about it. I'd be like, I'll get partial credit, so no big deal. I'll join that situation as well too. So, all right, and then now, what type of treatment or intervention? This is education, which is basically a select all that apply, right? So with PID, are we worried about administering or educating them on administering our ceftriaxone, doxycycline, and metronidazole? We are. Are we going to educate them? Well, we just talked about that. Educate them on safe sexual practices. Are we going to do a laparotomy on them? No. How about giving them fluids? Well, isn't NIPA something that we'd be considering? NPO, IV fluids? I would be okay with that. And then we talked about the follow-up for appointment with partner, getting treated. So, whoops. Yes, here. So again, now we just gained, if you got all of these right, you just gained 100% on 10 questions. So now your percentage is even going higher. Even if you made a silly mistake like I just made, or you second guess yourself like I just did. So again, building your score higher, knowing that each time you do a portion of this case study, you have the ability to take it that next step. It isn't hard when you know the content, but think about people that, what is going on here? Think about people that don't know content. How many people walked in not knowing PID versus endometriosis versus ectopic pregnancy to the extent of knowing the antibiotic, knowing that we have to let the partner know? Maybe you did know it. That's amazing. But think of the other people that are doing this. And my stylus stopped working. Okay. So, well, I guess that's a sign. I don't know. Let me see if I can get this back going. Huh. Okay, well, I guess that kind of concludes it. I will post the remainder of these questions on hopefully on YouTube. For those of you that are in the course, you will definitely get this lecture as well too, probably the full extent of the lecture as well. So with that said, because we're actually about to wrap up and do trivia. So remember, we got trivia today as well too. Nurse Brittany's going to lead trivia. There are prizes for the top 5, Nurse Brittany, correct me if I'm wrong.
Yep, exactly. Yeah.
Top 5 people are going to get prizes. I hope you enjoyed today's lecture. Nurse Brittany and myself worked on this to make a lecture that we haven't taught before, create new questions. So I do appreciate you all joining and spreading our word. If I made any mistakes, I apologize. Clearly, I did make a mistake. If I made any other ones that I didn't catch, then please forgive me. I'm only human. And if I can get better, please let me know how. And all we ask is that you post about us wherever you are. It doesn't cost you anything to spread the word. Places like Reddit, Facebook, Instagram, so on and so forth. With that said, Nurse Brittany, when would you like to get started on trivia?
Let's give them, I usually give them till like 7:10 Eastern time, just to let everyone get in.
Okay.
Sound
all right.
good?
Yeah, absolutely. So let's get started in 10 minutes. I'm going to hand everything over to Nurse Brittany. And then I will see you all next Wednesday. Next Wednesday, we don't know our topic yet, but I will be the one teaching it as well too. So with that said, everyone have a wonderful, wonderful week. Those of you that are in the course, I'll see you then. And take care. Nurse Brittany, it's all you.
Thank you, Dr. Z.
You're very welcome.
Okay, guys, I'm going to share the screen so you guys can all join in. Give me one moment. Here we go. Can everyone see that? Perfect. Awesome. Okay, so there's the pin. Just use your other device to join on in. And just remember, because I know some people were questioning this last time, you have to still watch my shared screen to view the question. But on your other device, like your phone,
or whatever you're using, that's where you enter the answer. So the other device isn't going to show the question. It's just going to show the answers. You still have to look at my share screen to see the question. Okay. So join on in. We will get started in about 10 minutes. Okay. Okay, so we're going to get started. Sorry, guys, I'm trying to find my unmute button. Okay, so let's see. Which lab value is concerning for a patient receiving heparin? So option D, PTT 30 seconds. Why don't we go with this one? Because 30 seconds is within normal range. So I wouldn't go with that. Platelets of 80,000. So heparin can cause something called HIT, heparin-induced thrombocytopenia. That's why I would go with this one, because of those low platelet levels. Option B, INR 1.0. INR is primarily used for warfarin, not heparin, so I wouldn't go with that. And then A, platelets of 180,000. This is a normal platelet count, and it's not something I'm freaking out about. Okay, let's see. Select signs of, this is a static question. Select signs of hypoglycemia in a diabetic patient. So option D, confusion. Yes, I would go with confusion. Option C, hunger. I would go with hunger as well. Yeah, so I would go with confusion. I would go with hunger. B, tachycardia. Why wouldn't you guys go with this one? Oh, wait, hold on a minute. This is status. Select signs of hypoglycemia in a patient. Wait a minute, this is wrong. This should be tachycardia, and it also should be sweating. Yeah, this is not a good question. This one's not correct. Sorry, human error. It was just marked wrong. Yeah. It's not, I would not just go with the D here. I would go with all of them, guys. Yeah, I would go with all of them. Sorry about that. That's definitely a typo, guys. An error on our end. Yep, I'd go with all of them. So if you put all of them, you got it right. Yeah. Okay, guys, so let's see. What is the priority for a patient with a suspected spinal cord? Oh, I'm sorry. What is the priority for a patient with a suspected spinal cord injury? So check capillary refill. Why did we not go with that one? Why do we not go with that one? Yeah, so definitely B over D just because airway, right? Definitely. Option C, control bleeding. Why don't we go with this one? I would say control bleeding is secondary to securing the airway. So I would get rid of C as well. And then immobilize the spine. It is crucial to immobilize, but I'm going with airway over all else. Exactly, guys. Yeah, I see all your comments. Yes. Does that make sense? So yeah, I would go with B. Okay, wait a minute. I think there is an error on the, hold on one second. I want to go back for 1 second. No, not this one. Identify the risks for postpartum hemorrhage. This is also a SATA, but this gestational diabetes. No, that's not a direct cause of hemorrhage. So I wouldn't go with gestational diabetes. Retained placenta, yes, because of the retained fragments, yes, it can lead to hemorrhage. Uterine atony, yeah, because uterine atony prevents like proper contraction and it'll increase that bleeding risk. So yes. So I would go with B. I would go with C, not gestational diabetes, but so far retained placenta, uterine atony, prolonged labor, yes. Prolonged labor does increase the risk. So I would go with A. So most of you are correct, A, B, C. Make sense? Sorry. I wanted to make sure to go over that. Okay. I don't know what's going on tonight. There's a couple errors. No. Pallor, I would go with pallor. Definitely pallor. With compartment syndrome. Definitely pain unrelieved by meds. Because unrelenting pain is definitely a key indicator. Paresthesia, yes. Numbness or tingling, that's a late sign of compartment syndrome. Exactly, Murtaza. Decreased swelling, no, increased swelling. So I wouldn't go with that. Make sense? Okay, let me double check this one too. So this is SATA. Identify the nursing interventions for a patient with neutropenia. So provide live vaccines. No, live vaccines are contraindicated. Monitor for fever. Yes. Yeah, I would go with that. Avoid fresh flowers. Yes, because that can harbor harmful pathogens. So definitely. Place in isolation. So isolation is not necessary unless the patient is severely immunocompromised. Okay, let's go over this one. Sorry if you hear my daughter in the background. She wants to play with us. So this is a SATA question. Identify interventions for a patient with hyperkalemia. Sorry, guys, I don't want to go over. I'm trying to go over the ones I see a lot of you getting wrong or that there's errors. I don't want to talk too much. So I do have a daughter. Her name's Mia, right, Mia? So identify interventions for a patient with hyperkalemia. Okay, so this is a status. So restrict potassium-rich foods. No, this should be correct because that's gonna, yeah, definitely. I would go with the, wait, restrict potassium-rich foods. Yeah, because we want to prevent a worsening of the hyperkalemia. Right? Am I reading? I would go with D. Yeah, restrict potassium-rich foods. Yeah, I would go with D. Administer sodium polystrine. Yeah, because that's gonna bind potassium in the GI tract for secretion. So excretion. So I would go with C. B, give insulin with glucose. Yes, insulin shifts potassium into the cells, lowering the serum level. So I would go with B. A, administer furosemide. No, because I wouldn't say furosemide's a first line treatment. I mean, it can lower potassium, but I wouldn't say it's first line treatment, so I wouldn't go with it. But I would go with B, C, and D. Yeah, I would go with B, C, and D. Okay. I know, I'm sorry, guys. I don't know why there's so many, I don't know why there's so many errors in the answers tonight. Yeah, I apologize for that. I don't know why there's so many errors. I know there's always, one or two, but today there's quite a few. I hope we don't run into any more. Oh gosh, all 200 of you. Okay, I'll talk to the team. I'll see if everyone can get a box. Okay, let's go over the last chunk of questions because I see you guys freaking out. Okay, I didn't want to talk too much, but okay, let's which was the last one you guys had a question that you guys were questioning? $20. Okay. I'm gonna go slow. Okay, there we go. Okay, this one. So a SATA question. Identify risk factors for venous thromboembolism. You're saying 19? Okay, let's start here. A patient received TPN, has a blood sugar of 300. What is the nurse's next action? Okay, so document findings. No, I wouldn't say documents priority. Increase TPN. No, that would worsen the hyperglycemia. Notify the provider. Yes. Yeah, that is correct. Yeah, I would go with B, notify the provider. Yeah, you should notify the provider. Oh, hold on. What is we have one answer. I'm sorry. Hold on. What is the nurse's next action? A patient's receiving TPN, has a blood sugar of 300. What does the nurse do next? Oh, and you guys all put, okay, so stop TPN. Yeah, but see the problem why this is tricky. Because I wouldn't go with stop TPN because if you stop it abruptly, that can cause rebound hypoglycemia. So yeah, whoever iPhone is, yes, I wouldn't go with A. I actually would go with B here. I would go with B. So let's see the next one. SATA identify risk factors for venous thromboembolism. Smoking, yeah, this is a SATA question, right? Yeah. So smoking I would go with because that definitely contributes. Low hemoglobin, no, that doesn't directly increase, no. Obesity, yes. Immobility, yeah. Oh my gosh, yeah. I would go with A as well here. A as well here, yeah. Definitely. Okay, that one's easy. Select nursing priorities for, I don't know what's going on with these. Something must have happened because there's too many that are, something must have happened with the, I don't know, something must have happened. No, immobility was right. That should have been one of the answers. SATA, select nursing priorities for a patient with yeah, I don't know what's going on today. I have to check on this. I don't know why there's so many errors today. So I feel it's too many. It's like something happened. Select the select nursing priorities for a patient with a chest tube. Okay, so keep below chest level. Are we going with this? Yeah, definitely, because that prevents backflow of drainage. So I don't know why that's not marked. Assess for air leaks, yes. Clamp the tube regularly, no, I wouldn't go with that. Monitor output, yes. Okay, so yeah, I would go with D here as well. Was there anything else beyond this? No, you guys got that. Okay, so I think we're good for now. So let's continue. Okay, so let's see. SATA, select interventions for a patient with a pulmonary embolism. Okay, monitor vital signs. Are we keeping that or chucking it? Yeah, I would keep that. Apply oxygen therapy. Are we going with that or no? Yes. Encourage ambulation. Are we going with that or no? So it's a SATA, select interventions for a patient with a pulmonary embolism. Yeah, no. You guys are thinking, some of you are thinking to prevent. But if we encourage ambulation with a PE, that'll dislodge, right? So yeah, we wouldn't go with B. For those of you that did try to choose B, I wouldn't go with B. And then what about administer anticoagulants? Administer anticoagulants. Is that an intervention for a patient with a pulmonary embolism? Yeah, I would go with A here as well. Definitely. So I would go with administer anticoagulants. That's going to prevent further clot formation, right? And that's a primary treatment for PE. Encourage ambulation, no. Bed rest, right? Apply oxygen therapy, yes. That's going to help with tissue perfusion. Monitor vital signs, like we said, yes, definitely. Just to monitor any changes, right? Okay, so let's see. SATA. Which findings indicate fluid volume overload? Crackles in the lung, yes. Edema, yes. Hypertension, yeah, because the fluid volume overload can increase blood pressure. Weak tready pulse, no. Abounding pulse, not weaker tready with fluid volume overload. Okay, let's see. You guys were questioning which one was it? The one we just did? Is that the one you guys are questioning? Is that the one is that the one you're questioning? Number 42? Okay, we'll go back to that after this one. I'm gonna go back and we're gonna do the last bunch. Let's just get through a few more and then we're gonna go through a bunch more. Yeah, scores in the 70s are definitely awesome. I wouldn't say I always say don't focus too much on the numbers though. Focus more so on that you're utilizing the Q bank the most that you can and properly. You don't focus, I wouldn't say focus so much on, oh my God, I'm getting 100 on all of these, or oh my God, I'm getting 90, or you know what I mean? Okay, so let's go over a few. So which one did you guys want to start with? Which one were you guys questioning? Which one were you guys questioning? I know you guys were questioning one of the ones around here. It's 40 something, I believe, right? 38 select side effects of beta blockers. So fatigue, is fatigue a side effect? It is. Hyperkalemia, no. Beta blockers don't typically cause hyperkalemia. Hypotension, yes. Bradycardia, yes. Beta blockers slow the heart rate, which can lead to bradycardia, definitely. Was there another? Oh, 42. Okay, 42. SATA, select signs of dehydration in an elderly patient. So decreased skin turgor, yes, I would go with that. Edema, no, that's fluid volume overload. Tachycardia, yes, because the body's trying to compensate. Dry mucous membranes, yeah, dehydration usually leads to dry mucous membranes. That's like a key symptom, definitely. Let's see. Which action is essential for a patient with a PCA pump? Increased dose for breakthrough pain? No. Um, no, you don't, as the nurse, you don't just make changes. No, I wouldn't go with that. Teach family to press the button. No, only the patient should press the button. Monitor respiratory rate. Yes, that's definitely important. Set a continuous basal rate. That's not always necessary. It really depends on the patient's pain needs. So I wouldn't go with that as well. Okay, let's just go over this one. Last one. So, SATA, select interventions for a patient post-thyroidectomy. Provide high iodine diet. No. No, I wouldn't. That's not a focus post-thyroidectomy, so I wouldn't go with that. Assess for hoarseness, yes, because that could indicate something to us, like nerve damage, which could be a complication. So definitely have tracheostomy kit available. Yeah, because airway from swelling or hematoma is definitely a risk. So you definitely want to have that ready. Monitor hypocalcemia. Yeah, wait, yeah, I would definitely go with A here. I don't know what's going on with these SATA question answers. Yeah, I would go with A, B, and C here. A, B, and C. Definitely, for sure. Does that make sense to everyone? Yeah, hoarseness could indicate laryngeal nerve damage, and that's a complication of a thyroidectomy. That's why we assess for hoarseness. You're so welcome, you guys. I'm so sorry about the mistakes with all those static questions. I don't know what is going on. I'll definitely make sure to check that. But yeah, thank you guys for understanding. Someone's still on vacation mode. That's funny. You guys are all winners. You guys are always all winners. But you guys did fabulous. Let's see what I know our results are a little skewed, but let's see. Okay, so third place we have TK, second we have 33171, we have first place we have 33882, and then of course we have a fourth and a fifth place. I know, it's not totally accurate, I know, but we do trivia every Friday night, so you guys have so many times that you're able to possibly win, and you guys are all winners. You guys are all winners no matter what, right? Okay, so did it show? It didn't show the fourth and fifth place, or it did? Why did I not see it? Did it show you guys fourth and fifth place? Why didn't I see it? Unless I missed it. Usually it has it in the back here. Yeah, something's going on. Maybe it's an issue with actually Kahoot. Because I don't know what is happening. Okay, we'll research. I'll have someone from the team pull it up and figure out how to. It did show? Okay, so well, if you got fourth or fifth, first, second, or third, please email us. I know there were a lot of errors in the SATA questions. I'm going to be on the lookout for the next trivia to make sure we avoid that. But thank you guys for understanding. But email contact@nclexhighyield.com. Okay. I hope everyone enjoyed. It's still so much fun and it's still so much learning because we get to go over a lot of them together, right? And that's a great way to learn. Okay, so I hope everyone enjoyed and I will see you next Friday. What do you mean access the questions? These questions that we did, you're not able to access these ones particularly. Oh, did I say, oh my gosh, did I say Friday? I'm so sorry. Not Friday, next Wednesday. I'm sorry, guys. My head's not screwed on right tonight. Next Wednesday. Wednesday is always free Zoom and then trivia immediately after. The email is contact@nclexhighyield.com. So any questions that I missed, anything at all, email contact@nclexhighyield.com. Okay? You guys are so welcome. Thank you for understanding. And I will see you guys next Wednesday, not Friday. Okay, guys, have a fabulous night. Awesome job, everyone. Bye, guys. Bye, everyone.